Across the United States, COVID-19 levels are rising, particularly in the western regions and certain states along the East Coast and Florida. The Centers for Disease Control and Prevention, CDC, has indicated that Alabama and other southeastern states are experiencing high levels of COVID-19. This marks a significant change, as it is the first time since last winter that the national COVID levels have reached such heights, with 36 states now classified under high or very high COVID levels. The data is largely drawn from wastewater monitoring across the country, providing a comprehensive view of the virus's spread. Despite the increase in COVID levels, emergency department visits and deaths attributed to the virus remain relatively low. Last week, COVID accounted for 1.6% of all emergency department visits, a significant jump of 16% from the previous week but still below earlier peaks. Similarly, COVID-related deaths comprised less than 0.9% of all deaths last week, a figure that has remained steady. This contrast suggests that while infection rates are climbing, the severity of cases requiring hospitalization or leading to death has not risen proportionately. This year's summer surge in COVID-19 cases differs from previous years, coming earlier than expected. Last year, similar increases were observed in late August and early September. According to a CDC spokesperson, the earlier onset of this surge reflects a change in the virus's seasonal patterns and highlights the continued unpredictability of COVID-19 waves. The emergence of new variants, often referred to as flirt variants, KP.3, KP.2, KP.1.1, and Pound.1, has contributed significantly to the recent spike in cases. Among the symptoms associated with these new variants, one particularly overlooked symptom has been identified: gastrointestinal issues. These symptoms include diarrhea, nausea, vomiting, loss of appetite, constipation, and abdominal pain. According to Dr. Adam Booth, these gastrointestinal symptoms can be easily confused with other common illnesses like food poisoning or stomach bugs, making it challenging for individuals to attribute them to COVID-19 without proper testing. Experts emphasize the importance of testing for COVID-19, especially when gastrointestinal symptoms are accompanied by more typical COVID symptoms such as cough, fever, and fatigue. Identifying the exact cause of these symptoms is crucial for proper treatment and preventing further spread of the virus. As the symptoms of COVID-19 can overlap significantly with those of other illnesses, testing remains the most reliable method to confirm infection. The recent surge in the emergence of overlooked symptoms underline the need for continued vigilance and public health measures. The increase in case numbers serves as a reminder that COVID-19 remains a significant public health concern, necessitating ongoing surveillance and readiness to adapt strategies as the situation evolves. This is particularly important as new variants continue to emerge, each with potentially different characteristics and implications for public health.